Hey, are you seriously thinking about getting an injection for your knee problem? Do you think that your arthritis is getting worse in your knee? Well, stop. Before you go get that injection, I need you to meet my colleague, Dr. Alyssa Kuhn. She's a physical therapist and she's an arthritis specialist. And she's got some simple exercises, 5 knee exercises that you can do to begin to get relief for your knee problem right now and possibly skip getting that injection. I've invited her onto our channel here to show you these exercises. So Dr. Alyssa, off to you. Show us the exercises.
Thank you so much, Dr. David, for inviting me on this channel. And I am so excited to share with you my top 5 exercises if you're dealing with knee osteoarthritis pain and considering a cortisone shot. So one of the things about cortisone shots is we rely on it for pain relief. But what if you could use your own muscles, use your own body to find pain relief? Because oftentimes I meet people who usually it's about a 3-month window every time you can get a cortisone shot. So they feel great in those first couple weeks, but then are begging for that cortisone shot again because pain gets to be so severe. So I don't want you living your life in 3-month increments. I want you out adventuring as often as you can. So these 5 exercises are going to help guide you through this and help you find knee osteoarthritis pain relief. All right. It's not only me that's going to be showing you these. I'm going to demonstrate these 5 exercises, and then I'm going to show you actual clients that are dealing with knee osteoarthritis doing these exercises as well. All right, let's get started. So, you're going to need a few items, and we're going to start going through these 5. Now, number 1, you're going to need a chair. This is one of my favorite exercises to get started with. If you want to stand to the back of the chair, both arms on the top, feet are going to be about shoulder width apart. You're going to have a slight bend in your knees. So I want you to take your knees from a straight position and just bend them very slightly. And you're going to keep your knees bent just like that the whole time. Now, what I want you to do is I want you to sit your hips back as you look forward. And then stand up, squeezing the glutes. Because I know that Dr. David talks a lot about glutes for knee pain and knee arthritis. And so we are going to continue with that. And this exercise is going to help you get stronger glutes. You're going to sit your hips back. Now, this is not a squat. I don't want you to bend your knees. Just a slight bend in the knees. Sit your hips back and then squeeze them up. Now, what you can do is you can add some speed to this where you're coming down and then squeezing up. Coming down and squeezing up. And I want you to really try to squeeze those glutes, but I don't want you to overextend. So I want you to keep your hands on the chair, squeeze, and come up. Once you master between 8 to 10 of those and can do it confidently, then what you can do is you can add weight, which is the video that I'm about to show you of a client doing this. She actually has weight. But you have to be able to keep that same position of a light bend in the knees, coming down and squeezing up. Because a lot of times we want to go down to a squat, and that's not what this is. This is a form of a deadlift where you hang onto the weight, you sit and reach your hips back, and then squeeze your glutes strong at the top. Take a look at one of my clients with knee and hip osteoarthritis trying this exercise.
Think about spreading your knees apart just a little bit. You're gonna bend your knees slightly, keep the kettlebell close, and you're gonna push your hips back and bend down to about the shins and stand up. Okay? Nice. Perfect.
For this next one, number 2 is a lateral step over. So all you need is an object. I'm just going to use this sponge. You can ultimately use anything that you can you put on the floor and it can stay in place. You're going to stand on one side of this object. Now, the higher the object, the harder it's going to be, and the lower, the easier it will be. All you're going to do is just push off with that outside leg, take a big step to the side, big enough where your other foot can fit. One of the common mistakes I see with this one is you take too small of a step and that other foot can't fit. So I want you to really focus on taking a giant step out to the side and then come back. Giant step out to the side and come back. A little unbalanced too, because we don't move side to side very often. And your glutes also control that side to side motion. So this is a great one for that. Now this is just simply stepping side to side over an object or a line on the ground. This one I like to do about 30 to 60 seconds. Once you get the hang of this, I would like to see if you could add some speed to this, where you're going a little bit quicker. And then like in the video that I'm going to show you of a client doing this, he was actually able to add in a small hop over the object. So pick your variation, start out slow, then pick up the speed just like this next client. Now number 3, it's called a march and step back. You can start with a chair on this one, especially if you're not so confident in your balance. You're going to put one leg in front. It doesn't really matter which one. I do recommend you do this on both sides, but I always like, especially when you're starting a new exercise, to start with a leg that's not necessarily the most painful first, so you can get some confidence and know what to expect. One leg in front and the other leg is trailing behind. What you're going to do is you're going to come up into a march, then you're going to step back. So this is called a step back and a march. March, step back. March, step back. Now you're ultimately standing on one leg when you're in that march position. So if you need to, keep a chair close by so that way you can master this one, because this one can be a little bit tough at first just because it's a new movement and it's hard on balance. But balance is also extremely important if you have knee arthritis. But notice your knee's not bending a ton, which is why this one can be pretty helpful and doesn't necessarily flare up any knee pain, but it gives you some confidence on that leg. So then I encourage you to switch to the other leg, maybe the leg that's a little bit more painful. Step back and then give it a try, marching up and stepping back, marching up and stepping back. If you need to modify, just go and make the step and the march smaller in the range of motion, because the higher you go, the longer you're standing on one leg. So step back and march whatever distance feels good to you at first, and then progress from there. Take a look at one of my clients doing this exercise. Now, this fourth one, you need one of these handy circle resistance bands, and I actually have some exclusive Keep the Adventure Alive ones, and the link's going to be below so you can purchase a set of 5 of these. What you're going to do is you can sit down, or if you can get this on in standing, make sure you have some support, and you're just going to put it right above your ankles. Let's say just a couple of inches above your ankles. This one you just need a little bit of space, so I'm going to walk towards you. This is a forward and backwards movement. So sometimes you see sideways with this one. We're going forwards and backwards. What you're going to do is you're going to step out on a diagonal. So it looks like this. You're kind of stepping out on that diagonal. We're going forward first, and this incorporates lots of hip and lots of glute action. And now what you're going to do is you're going to step backwards the same way. So you're going to step back in that diagonal fashion. Now I'm showing you from the front so you can see that diagonal. Now I'm going to show you from the side. So you're going to come forward, stepping out to the side, and then you're going to come backwards that same way. And this one is a little bit more difficult than it looks. And so usually I limit this to like 3 to 4 times down and back, depending on how long the place is where you're doing this. So the longer, like the hallway, the longer the area you have, the harder this will be because you're spending more time going in each direction. So limit it to, like I said, 3 to 4 times down and back, depending on how it feels for you. And then also be careful when you take this off. But I want to show you one of my clients doing this exercise.
So taking your foot out and then coming back, same thing, take your foot out.
Okay, so we are on exercise number 5. So this one can be really, really helpful if especially you have pain going down the stairs. So I'm going to show you on this step stool, but ideally I like to do this on the bottom step of a flight of stairs. Or you can do it outside. Just make sure you're on the bottom step, not on the top step. And once you see this, you'll see why. So again, we want to stick with starting with the leg that's maybe not so painful. You're going to put that on the top step. So I am facing away from the steps. The stairs are behind me. One foot on the bottom step, and the other one is just on the floor. Now, what I want you to do is you're going to push back and come up. Come back down, you're going to push up, bring that other foot to meet the one on the step, and then come back down. Push up and come back down. Push up and come back down. Now with this one, rails are very beneficial, at least when starting. And then I want you to get to the point where you don't necessarily need reliance, that you're solely using your legs. So once you do about 8 to 10 of these, then I want you to switch to the other side. Again, leg that's on the stair is pushing you back as you step up and meet both legs. Push back. The higher the step, the harder this is going to be. So if you need to start like on a lower step, or if you have just like a stable box or something at home that you feel confident stepping on, get creative with this one. But most of the time, people are able to do this on just a regular stair. Now, if your stairs are like abnormally tall, then you might have a little bit more difficulty. But just a regular flight of stairs, usually we have success with that. So go ahead and give this a try. Try 8 to 10 on each side and see how they feel. Now, take a look at one of my clients doing this exercise and then meet me back here.
So step down, step up. Step down, step up.
Okay, so now you know my top 5 favorite exercises for knee osteoarthritis, especially if you're considering a cortisone shot. Stronger legs and stronger muscles are one of the biggest keys for osteoarthritis pain relief. So that way you can find relief within your own body instead of relying on outside things to bring you that relief. Now, if you found this video helpful and want lots more guidance on knee osteoarthritis as far as other types of osteoarthritis too, head on over to my channel. The link is down below, but it's Dr. Alyssa Kuhn, Kuhn on the last name, or you can just search Arthritis Adventure because that's what I take you on, and I want to show you that adventure is possible even with osteoarthritis. Thank you so much, David, and here he is.
Thanks so much for showing us these exercises, Dr. Alyssa. I can't stress how important it is to get proper movement through the knees, hips, and foot and ankle joints in order to take pressures off these knees and save yourself from this arthritis getting worse so that you can avoid having a surgery that you may not need or relying on injections or pain medications. In most cases, just 10 minutes a day can help tremendously to bring down that pain level so you can skip out on taking these medications. I hope this video was helpful for you. If it was, please give us a like, give us a thumbs up, and don't forget to subscribe to our channel here so you don't miss any of the videos we upload every week. And you need to go over to Dr. Alyssa Kuhn, Arthritis Adventure. Go check out her channel and subscribe to it so that you can continue to get helpful tips for your knee problem. I hope you have a wonderful day. Bye-bye.